from iHeartRadio. This is Medical Monday, presented by St. Dominic's. This is Randy Bell, and I'm joined today by Amanda Jordan, the Director of Rehabilitation Services at St. Dominic's, and we're going to be talking about outpatient therapy. Amanda, by getting therapy for medical or mental health issues on an outpatient basis, certainly it allows the person to receive some help without an overnight stay at the hospital, and that allows them to continue on with some of their normal routines and living their lives. And that's really part of the whole picture, right? That's important, too, that they are able to maintain some sense of normalcy while getting the help they need.
Absolutely, Randy. We're here to help anybody who has chronic conditions or a specific injury or illness, either before or after a surgery, and help those patients keep their functional independence at home.
So when it comes to outpatient therapy, there are many forms of it. You touched on a little bit of it. There's physical therapy. There's mental health counseling. It could be someone who needs some additional help as part of a cancer treatment program. So it's a wide range of patients that you see.
It is a wide range of patients that we see. Today, some clinics only offer physical therapy, where other clinics will offer additional services such as occupational therapy and speech therapy. And then there are some clinics out there that also have clinicians that are more specialized, and they've been certified in treating certain diagnoses like lymphedema, pelvic health, neurological conditions, and hand injuries. So my advice to the patient is to find the clinic that best fits their needs at the time for the referral that the physician has given them for that particular diagnosis.
So we talked about maybe a cancer patient coming in. What sort of therapy would be offered there?
It really depends on the symptoms that they're having with their condition. A lot of patients are just weak and they need strengthening or endurance training with a physical therapist. Some people are having difficulty, getting dressed or making a meal, and that would be where occupational therapy would come in. And then sometimes, for example, with a cancer patient, maybe if they're getting chemo treatments, it's affected their voice. And then we have speech therapy that addresses conditions for swallowing and for speech. So it really depends on the symptoms that they're having from their condition as to what specific intervention they need.
So it can be customized according to what the patient's needs are. There's not like a one-size-fits-all type of therapy. It's whatever they need.
Exactly. Any initial visit to an outpatient therapy clinic is going to consist of an assessment of the patient's condition. And this assessment allows the therapist to work with the patient in setting goals for them to achieve the outcomes that they desire through that skilled intervention. And then the therapist will reassess those goals each time that the patient comes in for their treatment session.
I know that outpatient therapy is often the next step after someone undergoes a major surgery or is recovering from a serious illness.
It is, and then in today's environment, many insurance providers will require patients to get therapeutic interventions sometimes even before there's an option to undergo an invasive procedure or surgery that'll end up requiring significant downtime for that person. In addition, therapeutic intervention is typically prescribed following any major surgery, like a hip or a knee replacement, for that patient to gain full recovery and independence following that. In addition, if you have a patient that has a chronic condition or disease like multiple sclerosis, for example, sometimes it's good to check in with a therapist to get a brief assessment of your current functional abilities. And then if the patient or the therapist feels like it's time to jump in and have a couple of sessions, they can contact their primary care physician to get a referral for therapy to just kind of tweak whether it's their balance, their walk, their fine or gross motor skills, and get them back to their baseline to maintain their functional independence.
What would you advise a patient who may have a chronic illness or intractable kind of pain they're not having any solutions with elsewhere? What would you say would be their next step in maybe looking at the possibility of getting some therapy?
The first thing that they want to do is reach out to their physician, because any outpatient therapy clinic is going to require a referral from your physician. The next thing I would suggest is to do some research. There's so many therapy clinics out there today. I mean, you see one on almost every corner. You want to make sure that the clinic that you're going to offers the service that you need, whether it's physical therapy, occupational therapy, speech therapy, or even a specialized service.
And that's Amanda Jordan, and I'm Randy Bell. Medical Monday is presented by St. Dominic's.